Okay. Good day, my viewers. You're welcome to Study Room with Osadolor Asemota. I've created this study space, it's an information space to be able to share with you my thoughts on current issues. Today, I'll be looking at the COVID-19 infection, the COVID-19 disease, also known as the coronavirus disease, and its implications, and on mental health. I am a chief medical officer with the Health Services Department of the University of Benin. I'm a public health physician. I'm also interested in microbiology. From what we now know, COVID-19 is a causative agent of the now popular coronavirus disease. It said it's an RNA virus, is the current cause of the current pandemic that is ravaging the entire world. It was said to have been first noticed by scientists in a place called Wuhan province in China, in Asia. As at today is 13th of April, available records shows that over 1.8 million people world over have the disease, as reported in accordance with the applied case definition and testing strategies in the affected countries. For example, in Africa, over 14,000 people, or we have over 14,000 cases with over 789 deaths. In Asia, we have over 295,000 cases with over 10,000 deaths. In America, we have over 600,000, about 644,000 with about 25,000 deaths. Out of about the 647,000 cases in America, US alone account for well over 500,000 with over 22,000 deaths. It's unprecedented in the history of America, United States of America. In Europe, we have close to 1,847,000 deaths, well over that, with UK having about 84,000 and Spain having about over 160,000. And the death cases in Europe is over 10,000 in UK. So it's quite alarming. It's unprecedented. It's unusual. The world is not known to it. In Nigeria, where I am, we have as of today over 300 cases. With about 85 have recovered. We've recorded in Nigeria about 10 deaths. So this virus actually presents as an upper respiratory tract illness, and is similar to a pneumonia with symptoms that suggest that may make you think that it's a pneumonia, but a highly contagious disease and can spread from person to person contact from respiratory droplets that are released into the air when an infected person coughs or sneezes, and possibly by touching a surface or an object with the virus on it, and thereafter touching your eyes, your nose, or your mouth. So this last mode of transmission is still being debated by WHO, but it has been noticed. Now, the WHO report on China says that 80% of cases had mild symptoms. However, the danger for severe illness is higher in some people, particularly those who are over 5 years of age, those who are immunosuppressed, persons with existing health conditions like heart disease, like lung disease, cancer, diabetes, high blood pressure, and even those who smoke. So these conditions can become worse. Whereas the virus itself may be mild for most persons, the concern for those of us who are healthcare provider is the spread of the condition, which can overwhelm the facilities in hospital. It can bring down the economy. That is our worry. Also, the availability of testing kits is not readily available. even in the best of economies, like in Europe and America. So many people are now being asked to self-isolate, self-quarantine. If you see the three key symptoms of this uh, infection, which are fever, cough, and shortness of breath, you know, they are asked to avoid going to hospital and to seek urgent care in the facility, in the healthcare facility, unless these symptoms are severe. Like these three symptoms are similar, also symptoms that we see in cases like a common cold or flu. So how do people now differentiate when they have this COVID-19 infection and when they have things like common disease? So this now lead to heightened tension. Somebody has fever, he has cough, and he's worried. Unfortunately, they cannot readily get tested because the facilities are not yet as available as we want it. So this, to me, is a major mental health concern. Now, these are now compounded with such issues. You see, government people, celebrities, and social media influencers keep encouraging people to stay at home, to maintain social distance. Restaurants are being closed. In fact, the world currently that we live in have never been as strange and as turbulent as we now have it. So this put a lot of mental health issues, that we follow this pandemic. They are quite myriad. There are many, particularly mood and personality disorders, which will be more in those who were already struggling with such mental health issues. So that is why I came out now to try and enlighten us, because I feel it's very key that for us to have information. For example, social distancing in itself, as good as it is in the control of the spread of the coronavirus disease, in itself, social distancing increases the feeling of isolation, the feeling of loneliness, the feeling of stress and fear. Social distancing, it has in itself some issues that may impact negatively on mental health. And some of these issues of feeling of isolation, loneliness, stress, and fear are features that we could call like trigger factors, things that can trigger mental health illnesses. And some of the mental health illnesses that we need to watch out for in this era and post this era of pandemic is one, anxiety disorder, in particular generalized anxiety disorder. We have depression, we have obsessive compulsive disorder, we have substance abuse, eating disorders like anorexia nervosa, bulimia nervosa, and binge eatings. We have attention deficit or hyperactivity disorder, even the bipolar affective disorder, which used to be called the manic depression disorder, schizophrenia, post-traumatic stress disorder. These are all issues, mental health issues that we need to watch out for in this era. But let me encourage you, so long as at today there is no known treatment, there is no acceptable treatment protocol, there is no known vaccine that is approved anywhere for use. So the mainstay of management as at today still remains prevention, preventive measures. So you must prevent so that the pandemic can come to an end. First, you need to um, do regular hand washing. You must wash your hand for at least 20 seconds with soap and water, or rub your hand with alcohol-based rub, which we call in our environment sanitizers, so that you wash your hand with water and soap, and at least you have an alcohol-based rub. You must wash, after washing your hand, you must also cover your nose and your mouth with a disposable tissue or a flexed elbow. When you cough or sneeze, you cough into your elbow. That you sneeze into your elbow, as I've done. You flex your elbow, you either cough into it or you sneeze into it. Then you must also avoid close contact, at least 1 meter or 3 feet, with people who are unwell. You must stay at home and self isolate from others particularly those who feel unwell. But for those of us who are who work in the hospital, the frontliners, what are we supposed to do? I read in one of the articles that if you must collect your patient now, you must give some level of distance. And if your examination is not going to influence the diagnosis you are thinking of, there is no need. If you want to engage on the palpation of the abdomen, you want to sound your patient's step with the stethoscope, if in your opinion you know that it will not affect your line of reasoning, your diagnosis, then I encourage you, you must put that off. Because even the healthcare giver must, at this point, you must play safe. And now, if you have accepted that probably examining your patient will influence your diagnosis, then as a healthcare professional, healthcare giver, a doctor, whatever, you must now wear your PPE, personal protective equipment. You must be fully kitted so that then you ask your patient to look elsewhere. In the event of a cough or a sneeze, it doesn't come directly at your face. It's very key. Then for those who are not maintaining close contact with patients, you must properly wear your face mask, approved face mask. You must wear your gloves. Thereafter, you must, in between one patient or the other, you must wash your hands and wash them thoroughly, as I've already enunciated in my advice. Then, conclusively, we're looking at the best practices for those who are in self isolation. What are the best practices for those who are in self isolation? Those who are being quarantined. My own counsel, if you already have a doctor friend, you have his phone number, it will do well for you. My first counsel will be that you don't need to wait for symptoms to escalate before you pull a call across to your doctor. You need to speak with your healthcare professional, your healthcare giver. If possible, you can schedule time with him, either weekly, depending on how close you are to, so that once in a while you talk with him to explain to him how you are feeling so he can give you counsel. You must seek and keep a regular routine where you are self-isolating. You could have regular routine, time to eat, time to read, time to check on yourself, time for sports, time to see movies, time, create time so that at any point in time, you are not just seated in one place. Because even there are even medical issues like different thrombosis that have been noted in some hospitals as a fallout of people that are having to isolate. So in order to avoid that, you need to engage in some regular routine. I also talk about the need for you to talk routinely and regularly to friends and family members. You must engage your friends and family members, even if via phone call. It's very, very key. So you don't experience issues with your mental health and even with your medical state while you are in isolation. Then we're looking at the need for us to be sure you have a stock up on your medications, particularly those who are on chronic conditions. You have heart conditions, you have whatever conditions that you are on medication. My counsel is that you should have a stockpile of them so that while you're on a quarantine, while you're in isolation, you have enough. It gives you this confidence that you have enough. So there will not be need for panic. Then the last one is you must remember that while this challenge is going on, more infections may come up, particularly in the time being. Like 2, 3 weeks ago in the US, those that were infected, even were about 300,000. But as of today, it's well over 500,000. Deaths about 2 days, 3 days ago was less than 10,000. Death recorded in the US as of today is well over 16,000, about 18,000 thereabout. So we need to know that whereas this infection is going to grow, this COVID-19 infection, I want you to also know that it is not a terminal diagnosis. So this should give you an encouragement. Whereas there is room for you to be scared, or to be worried, but don't be too worried. You must try to keep the facts in your mind. That is why you must listen to trusted health channels, trusted health services sources, those that can give you the right information. The essence of this talk is to allay your fears. I don't want you to remain in fear, to be so worried and anxious, because, like we know, this challenge that we are in now, it has come. We're already battling it. As the time roll by, knowledge and information will be more about it. And I know, I do trust that we shall surmount this challenge Once again, it has been study room with the doctor himself, Osadolor Asemota. I have come to give you this tip so you could be rest assured that all hope is not lost. We need to be focused, we need to be positive, and I very much believe we shall surmount this challenge. Thank you for listening, and God bless you. If there are questions you have at the back of your mind, you can send them to me on my Facebook page, and I will try to respond to it. Thank you. God bless you. Do have a calm day. Bye.
That's why you talking to me.